started, and here is your question. Right, so if you have read and understood, considering that history-taking session, can we begin?
Hello, I'm Dr. Dafar, one of the surgical doctor looking after you today. Could you confirm your name and date of birth, please, or age, please?
I'm 67-year-old. I'm Mary.
Good.
Nice to meet you.
Yes.
Nice to meet you too, doctor.
Yeah. Could you tell how can I help you today?
Doctor, I recently had 2 episodes of vigorous shaking of my body. Then I suddenly collapsed, and I don't know afterward what happened to me. And there is an episode of. Sorry, you go ahead, doctor.
Yeah, complete. Yeah. Sorry to hear that. Could you tell me more about that?
Yeah, doctor, I had 2 episodes for last 2 months. I was at home. My husband noticed that I had a regress shaking of my body. Then I fell. Uh, After that, I have no recall of the whole of the event.
Okay, I'm sorry to hear that. Can I ask you when you said in the when and where you when you got this shaking of the bed firstly?
Doctor, this happened in the morning. I was preparing a breakfast for my husband. That time that this happened.
Okay, as well. Do you feel anything or any sign before you develop this shaking?
No, doctor, no. As of now, I don't recall any sign or anything which happened to me before this shaking.
Did you trip over or slipped?
No, doctor, I don't like having that like any predisposing factor like that.
Did you lose of conscious?
Yeah, doctor, my husband told me I was not knowing of the event, what happened to me.
So did he say how long you lost conscious?
According to him, it was around 30 minutes, doctor.
30 minutes. Okay. So you said that you fall exactly. Did you hit yourself?
Doctor, there was no bruising over my head, but I don't know. My husband told had no idea regarding
Okay.
this.
So did you bite your tongue or hurt yourself
No,
apart from
doctor.
the bruising? Yeah.
No, doctor. No, doctor.
Did you told you about whole your body shake or part of your body shake?
Yeah, doctor. It is of my upper limb mainly, right upper limb. He said it starts from my hand, then it goes up to my shoulder.
Okay. Yeah. After that, after finishing of this shaking, did you feel how for you take how long for recovery?
Doctor, I was confused after this episode. I don't
Yeah.
know. It take me off one whole day even. I was literally confused. I was literally drenched out.
Okay. Do you feel any drowsy throughout or
Yeah, doctor, I told you it will take almost 1 day for me to get recovered from the episode. I
yeah,
totally got
okay.
drowsy, drenched out.
Do you have any trauma to the head?
Doctor, I already told you. I
No,
have a
before,
bruise on.
before.
No, no,
Any
no,
trauma,
doctor.
any history of the trauma? No. Yeah.
No, doctor.
Do you have
But
any?
doctor,
Do you have any?
I want to add, doctor. During the episode, my clothes was soiled with my urine. I felt
Yeah.
very
Okay.
ashamed about this.
Don't sorry about that. It is might happen with patient with epilepsy. We are try to help you to control these. So I just want to
Doctor, what
ask
is
if
this
you have
epilepsy?
epilepsy. It is mean it is something insult in your brain. So we need to arrange for this, and we will talk history from you, and we send you some investigation to rule out what is the cause for this. I want to ask you, do you have any episode before this, or this is the only one?
No, doctor, I have 2 episodes for the last 2 months.
Yeah, the second one, it is the similar to these or not?
Yeah, doctor. My husband told it was similar to the first episode. That's why we consulted you for the third one.
Do you have any fever?
No, doctor, I don't have any fever.
Do you have any weight loss?
No, doctor, I don't have any
How it,
weight loss.
how it is affect your life?
Doctor, it is embarrassing for me. It can happen anywhere also. It can happen
Yeah,
when I
I can
was out.
imagine how it's. Yes, I can imagine how it is bad. So, do you have any past medical surgery?
No, doctor.
Do you have any medical illness?
Yeah, doctor, I'm a diabetic patient. I am
Yeah.
on medicine. I am a hypertensive patient. I am on medicine for the same too.
Okay, can you present your case now?
72, 76 years old, on
67.
background,
67.
67. It's okay. Sorry, 67 years old, with known case of diabetes. She's suffering from the 2 episode of epilepsy. It is started at the home. At the home, shaking from the upper limb. From the upper limb, it is to the right shoulder. She loss of conscious. She lose of control of urine water work, and also
So what are your differential diagnosis?
my differential diagnosis, it is might be epilepsy or meningitis, encephalitis, transient ischemic attack, TIA, hypoglycemia.
Okay. How do you plan to manage this patient?
I will complete my history. I will examine the patient properly, neurological examination, and I also I send him for the complete blood picture, blood group, ABG,
What are the treatment
electrolyte.
options that you can offer to this patient?
The treatment option, it's during the episode and the after episode. After episode, I will ABC, oxygen monitoring. Firstly, at the time of seizure, I put the patient in the safe place, put it on the left side, try to avoid the pitching the tongue and avoid aspiration. Post-actally, I will treat the ABC. Okay.
Okay, good. Yes. Feedback, Dr. Kuldeep. Can you give feedback first?
Dr. Zafar, it was nice, but I just want to add one thing. You shouldn't use the term epilepsy. You enter in the different plane in the history.
Yeah.
And second is, I have mentioned, I have to mention I have soiled my cloth. Because it is given in the stamp, you have to use that information. What I can understand, because it will save your time.
Yes.
Yeah.
Because because I have already told you in the brief history ki what happened at home, you can utilize that history rather than asking again and again, because
Yeah,
it will save time. Matlab,
it will save time. And Dr. Kuldeep, for you, do not use Indian words too much. Not
so
all of
sorry,
them
ma'am.
understand your, yes. So if you are explaining to Dr. Zafar, so he
So,
may not
sorry, ma'am.
understand your Indian words. So
Sorry, ma'am.
Yes.
yes, what
So,
Dr. Abbas is writing, Dr. Zafar, you even forgot to tell me the parts of the history that you have missed, or because of
yes.
the time, eyes, and even the social history or the family history, past.
Yes, I put it in mind about, but Gino, he's take me away from the history. When he
No,
asked me
no.
about epilepsy, the patient didn't ask about, could you tell me what's it about epilepsy? This is the take two time.
No, that's
And
okay.
when
Patient can ask you. You are not supposed to discuss the diagnosis with the patient. This is like you have to write set of questions that will cover seizure. And if you want to give epilepsy as your first differential, then you have to tell me management as well, because here it was not, I did not ask you acute medical and management of the patient. Patient is already in A&E. From here, what would you do next? So you'll discuss with the MDT team, and then you'll tell me what management, or because of the investigations that you'll do, that will decide what management you'll do. And then it is 67-year-old patient, that's why the most common could be tumor. But then if you say epilepsy, then you can say, okay, brain tumor could be one of them. Even okay, you give good, these are also acceptable, the differentials that you mentioned, but still most likely are stroke could also be one of them. You said TIA twice, TIA and then transient ischemic attack. Okay, that's kind of repetition, like it means that you're telling me to. So TIA could also be one, and stroke can also be one, tumor can also be one, even epilepsy can also be one. Then okay, meningitis can also be one, but meningitis patient already said has no fever, so meningitis is least likely. You did not ask in your presenting complaint if patient wakes up with morning illness, or if there is any nausea or vomiting during the day. You asked about the weight loss, but forgot to ask about the appetite, muscle aches, because if it's meningitis, then there'll be body aches, etc. as well. So yeah, you did ask about the trauma twice, all right. So yeah, basically was what Dr. Kuldeep was saying. I have to agree with it. Some of the questions could have been avoided, or could have been yeah, in order to save time. So repetition could have been avoided. Good, thanks. Started, and here is your